So the next step in immunotherapy is, all right, so we've got checkpoint inhibitors helping some people, just single agent, and it works like a charm. But that's not the majority of patients. And we believe that if you can combine different approaches with checkpoint inhibitors, you'll actually generate additional immune responses. There's a lot of science going on in this space. Remember, what a checkpoint inhibitor does is prevents that so the immune response is being blunted by this checkpoint pathway. So the T cell's there ready to get at them, and all the drug does is break that barrier so the T cell can do its job. So some cancers don't have that T cell sitting there. They're not immunogenic, if you will. So if we can make tumors from sort of quiet, cold, we call them, to hot, immunogenic, inflammatory, then in fact we might be able to generate those T cell responses. And so vaccines, one approach. We know we can stimulate a patient's immune system. We can use specific antigens like CEA or MUC1, some of the work we've been doing, but there's other work looking at what we call neoantigens, or personalizing the vaccine so that the patient's tumor does the talking and stimulates immune responses that way. Combinations of the different checkpoint inhibitors are being used, as well as other things such as radiation and chemotherapy to make tumors more immunogenic. So stay tuned in this space. There's lots of studies going on in the so-called non-immunogenic tumors to try and generate more immune responses.